Like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Himmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry. Chairman, you have a quorum.
All right. Thank you, clerk. Do any of the members have any personal orders? All right, seeing none, I do want to make an announcement for the members and those that are presenting bills today. Last week, obviously, there was we were not able to meet in our normal committee room, and because of some conflict within the different committees, we were not able to take up last week's calendar. And so we're going to go with those bills first and work with the speaker and Chairman Zachary. So if you're one of those bills that got rolled last week because we could not meet, if you get your bill through this committee today, notify Chairman Zachary's office that you would like to put your bill on calendar and rules for this week, and he will put you on the addendum calendar for this week. So with that said, we have 24 items on today's calendar, and we have some of the bills that we need to take off notice or to roll. So item number 7, House Bill 2233, has been taken off notice. Item number 18, House Bill 2366, has been rolled 1 week. Item number 21, House Bill 628, has been rolled 1 week. And item number 24, House Bill 2816, has been taken off notice. So that brings us back to our calendar for the day, and we're going to take one of the items out of order. We have some folks here that are going to testify, and they actually came in last week to testify and weren't able to because of the conflict. And so we're going to go to item number 3, House Bill 1969 by Chairman Jernigan. You are recognized. You have a motion and a second.
Thank you, Chairman, and thank you for taking me out of order. Members, after working with the Department of Commerce and Insurance, the Department of Human Services, and the State Fire Marshal, this bill is amended is going to align with the 2021 International Building Code and Fire Code requirements for carbon monoxide alarms in daycares. It'll codify the carbon monoxide alarm requirement for daycares. It will require each child care agency to have a carbon monoxide alarm in every room where child care is provided to children. It establishes that each day a violation occurs, it constitutes a Class C misdemeanor, which is the same as not having a fire alarm. And last, I'll just add that a carbon monoxide alarm costs anywhere between $10 and $15. And with that, I've got some constituents here, and I have to go out of session.
Before we do that, you do have an amendment. Is that correct?
I have an amendment.
Okay. Drafting code 014029. Is that correct?
That is correct, sir.
Okay. If there's no objection, let's go ahead and get that amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. So we do have some guests here to speak. So without objection, we will go out of session to hear from your guests. Okay, Haley Montgomery.
Thank you.
And if you can, I think they're getting the red button push for you. Tell us your name and who you're with, and
Yes, I am.
2 minutes.
Thank you for having me, and I apologize for any ad lib in advance. I'm Haley Montgomery. This is my daughter, Grayton Montgomery. She's not quite used to formal settings like this, so we're going to do our best today that we can. But do appreciate your time. I'm a first-time mother. I am also a working mother whose household depends on my income. We looked at probably 10 daycares while I was pregnant, trying to find the perfect center that not only worked for us, but that could take us. And after asking every question you can imagine, from how do you train your teachers to your safety protocols, we ended up at Elm Hill Academy. On November 3rd, 2023, I refused to leave Gray at the daycare because of a scent in the building. When I complained, I was told the smell was normal for that heating system. On January 5th, 2024, our lives changed. My husband came to drop off Gray and instead saw all of the teachers and students standing outside with the fire department. A parent had decided to bring in their own CO monitor and found that it was at alarming levels and had evacuated the school. It was bad.
Yeah.
Despite the fact that we never went into the school, we took Gray immediately to be tested, and she tested for over double what anyone should have in their body for carbon monoxide, and she was only 8 months old. That is also when we found out, after being put on 6 hours of oxygen to get the carbon monoxide out of her system, that's when we found out the devastating effects of carbon monoxide potentially on her body. And although you might not believe it, we were quite scared how it would affect her lungs. And we unfortunately are still scared every day of how it might affect her development, as we don't know the long-term effects. I do not know what would have happened that day if the parent hadn't brought in their own carbon monoxide monitor and caught the leak. I also do not know how long Gray was exposed because there was no functional carbon monoxide monitor in the school. What I do know is that the source of the carbon monoxide was the HVAC unit that I complained about a month ahead of time. I know that in 1 month, we've been to the doctor and ER over 4 times for fear of Gray's well-being. I know that anytime my child coughs at night, me and my husband stop sleeping and start worrying. And I know that because there were no CO monitors, that I will be analyzing every developmental step my child takes, looking for lasting effects of carbon monoxide. As parents, we can try to ask all the right questions, but how many people in this room would have told me to ask the school if they monitored for carbon monoxide? This leak impacted nearly 100 families plus all the employees at the school. My hope is that no parent of a small child ever experiences this again, and I'm grateful for any help that you all can offer today towards that. Thank you.
Thank you. Do we have any questions while we're out of session? Well, thank you for your testimony, and sounds like she's all right, and you got the treatment, and so appreciate you coming up here and sharing your story. We apologize for the events of last week that precluded you from being able to testify with us, but again, thank you for this, and I'm going to tap the gavel so that we don't to go back into session. So without objection, we will go back into session. All right. Any questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 1969. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations. All right. That brings us back to the brings us back to the top of the calendar. House Bill 1883. Representative Capley, you are recognized.
Thank you, Mr. Chairman. House Bill 1883 allows for individuals who are acting as a durable power of attorney in healthcare to receive daily in-person visitation.
Okay. Yeah, I
With
got a
the
motion in a second. Okay.
Thank you, Mr. Chairman. House Bill 1883 allows for individuals who are acting as a durable power of attorney in healthcare to receive daily in-person visitation with the patient to evaluate their condition. These visitation rights are still subject to the hospital health and safety protocols to ensure the protection and privacy of other patients. These visitation rights are not to be terminated, suspended, waived, or limited during declarations of disasters or emergencies. Mr. Chairman and members, it's crucial that when these durable power of attorneys are making healthcare decisions on behalf of another individual, they can evaluate the patient regularly to make educated decisions on the patient's behalf. And there are several limitations within this piece of legislation. And Mr. Chairman, I'll quit while I'm ahead, I guess.
All right, thank you. And I believe we have an amendment for your bill. Okay, 014181, is that correct?
Yes, sir. That
Okay,
makes the bill.
Okay, you have a motion, a second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. Do we have any questions for the sponsor of the bill? Chairman Clemens, you recognize.
Thank you, Mr. Chairman. I was just curious what the amendment amended.
You recognize.
Thank you, Mr. Chairman. So we had some questions in subcommittee, and we added an amendment that basically says that the patient would reserve the right to deny visitation at any time as well. We included that.
Chairman Clemens, you good? Okay. Any further questions for the sponsor of the bill? Representative Hakeem, you recognize.
Thank you, Mr. Chairman. I'm just for clarity, is it normal to have an attorney who's, I guess, allowed or accessible? I think this is saying every day that they can be there.
You recognize.
Thank you, Mr. Chairman. So this would be the durable power of attorney. So say you were in the hospital and, you were incapacitated in some measure, that your wife or whoever that you had called to be your power of attorney could be able to see you within reason for every 24 hours. And like I said, Mr. Chairman, there's several limitations in it as well. And I can, if the committee would like, I can go through that.
Thank you.
Any further questions for the sponsor of the bill? Chairman Kumar.
Thank you for doing that. I think for the record, it will be good to clear the air and go ahead and mention the limitations that you were.
You recognize.
Thank you, Mr. Chairman. Thank you for the question. So the limitations we have in the legislation, the right to visitation is subject to regular hospital visitation hours. The hospital is required to make a reasonable effort to ensure that a minimum of 1 hour for the visit. If the patient is under custody of law enforcement, this would not apply. If the patient's undergoing a surgical or invasive procedure, this would be limited by the hospital as well. And this would only be subject, the legislation would only be subject to those that are admitted into the facility.
Thank you. You put a lot of effort into it, and thanks a lot. Thank you, sir.
All right, any further questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1883 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. If you wish to be recorded as a no, please tell the clerk, and the bill will go on to calendar and rules. And again, if this is one of the bills last week that we had rolled, and so if you would like this to be heard on an addendum calendar for calendar and rules tomorrow, have your staff notify them. Thank you. That brings us to item number 2, House Bill 1922. You have a motion and a second. Representative Butler, you are recognized.
Thank you, Chairman. We have an amendment we need to put on there
And the amendment,
just to make a fine tune to the legislation.
okay,
That's drafting code 14589.
okay. We have a drafting code 014589. We have a motion and a second. Okay, if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. Okay, you are recognized on your bill as amended.
Thank you, Chairman. This piece of legislation actually expands the locations that we can put a safe haven baby box. Unfortunately, in rural counties, many of which that I represent, there are no places that meet the criteria that we have in current law. They have to be manned 24 hours. And many times we don't have manned fire departments because they're all volunteer. So this legislation simply expands that to nursing homes that are in the 21 counties that do not have a hospital, and to participating emergency communication centers. And so with that, I'll be glad to answer any questions.
Do we have any questions for the sponsor of the bill? Representative Bain, you're recognized.
Thank you, Mr. Chairman. Representative Butler, I'm the newbie here. Just a question, what is the genesis of baby boxes? Do you know, like where the idea comes from?
You're recognized.
So a number of years ago, I think one of our colleagues in this room was instrumental in helping pass that legislation a number of years ago. And a Safe Haven baby box is a baby box that a child can be left anonymously. The boxes are monitored. They're typically connected to an alarm system where the alarm alerts. And Station 17 in Knox County had the very first one in the state of Tennessee. It was installed in February of last year, and it saved 2 babies within the first about 4 months it was in place. So they're effective, they're monitored, they're heated. It is a safe place to put a child. And I think the more places that we make available for Safe Haven baby boxes, the more babies we will save.
You're recognized.
Thank you, Mr. Chairman. So I was more talking about the historical genesis, but thank you. I was doing my research before this committee meeting, and I had no idea where the actual genesis came from, which apparently it is from medieval Italy. A system of anonymous infant abandonment amongst the most vivid modern expressions of the Roman Catholic Church, their centuries for long shaming of women for their sexuality and assertion of control over their bodies. And I didn't know that, so just as a highlight. The second question I have is around, I think there's been some discrepancy or some discussion as to the amendment and the liability that then some of the facilities that are recommended in this legislation would have based on your legislation.
You're recognized.
The original legislation that was drafted not only for the Safe Haven locations, which was done 20-something odd years ago, the Safe Haven baby boxes were added a number of years ago, but there's immunity for any place that has a baby box or that is a Safe Haven drop-off location. They all have immunity as long as they're acting in good faith. And so this particular legislation, the way it's been drafted, includes that immunity for these locations.
Okay.
You're recognized.
And this is just an email I received a few hours ago, but I guess there's some concern around the language of ECCs may have the ability to decline the possession of a newborn infant should a mother show up wishing to surrender, and the ECC location is, per the amendment, not a facility because they haven't installed a baby box. So the concern is that this could potentially impact the newborn's safety if the mom is turned away.
You're recognized.
Well, most of your Safe Haven baby locations have the appropriate signage and so forth to indicate that that is a Safe Haven drop-off location. There are a couple of emergency communication centers that have fences around them, and there was concern that those babies would be left out by the fence and nobody be notified where they physically couldn't knock on the door. And so that's why this was done. So the signage, if there are not a participating emergency communication center, they would not have the appropriate signage to indicate that they are a Safe Haven location.
You're recognized.
Thank you, Mr. Chairman. Appreciate you addressing the concerns. I will not be voting for this just because I believe that we should be offering people who can get pregnant a society that is supportive in terms of their emotional and monetary circumstances instead of offering a box to put their child in. But thank you.
Chairman,
You're recognized.
this legislation only does provide a drop-off as a box, but it also provides a location for you to drop off face-to-face.
Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. Sponsor, is this legislation permissive?
You're recognized.
Yes.
You're recognized.
Thank you. And can you talk about the average turnaround times and how the alarms are checked to make sure they're working?
You're recognized.
That's a great question. I think the one in Knoxville, the baby was in that box less than 2 minutes, and I have read situations across our nation. I think Indiana has the largest number of Safe Haven baby boxes, which is where one of the manufacturers of these boxes are, and they are typically in the box less than 60 seconds. The alarms go off. If you install one of these boxes, they have to be tested typically about 7 days in a row before they are put into use. So it's very closely monitored to make sure that if a baby is placed in that box, somebody is notified immediately.
Good. Representative Hill, you're recognized.
Thank you, Mr. Chairman. And a question for the sponsor. Were you contacted by the Roman Catholic Church to carry this legislation?
You recognize?
I was not.
You recognize?
So real quickly, the Vatican didn't call you?
You recognize?
He did not.
All right. Okay. Mr. Chairman, I'd like to quickly applaud the sponsor for bringing a very pro-life piece of legislation, which I understand there's certain members of this committee cannot vote for anything that resembles pro-life legislation that can protect the life of an innocent baby. I understand that. At the same time, I must say, Mr. Chairman, I am grateful to see legislation that I carried a few years ago implemented. It's been proven, it's been demonstrated. And I'm also grateful to see the sponsor expand on a concept that was difficult to get past. And it wasn't difficult to get past because of this issue or that issue. It was difficult to get past because it was groundbreaking. It's different, and it's an innovative way to take care of babies in a way that, historically just hasn't been done. And so thank you for taking it the next step. I'm proud to support your legislation. And I'm also grateful to know that what we did back then was the right thing, and it's being demonstrated by what you're carrying forward today. So it has my full support.
You recognize? Chairman Boyd, you recognize?
Thank you, Mr. Chairman, and sponsor. As I hear you talk about that, I didn't even know this was a thing until a couple of years ago, and I learned about it. But as a parent, my kids are teenagers now, and it's nice. The lady that was in here a minute ago with Representative Jernigan's bill that testified about the carbon monoxide and having her baby with her. I leaned over here and I know Representative Capley's doesn't have children yet, but I said that is the sweetest baby I've ever seen. And it's hard to remember when our kids were that little, but it's just a reminder how precious those children and babies are, and especially how vulnerable they are. And so, like I said, I didn't realize this was even a thing, and so I didn't know you had carried it, Representative Hill. So I'm going to commend anybody that has carried this along the way and the small part that you're playing in it today to protect those innocent babies when you consider the alternative, especially. Thank you.
You recognize?
Thank you. I appreciate the comments. I really do. And I think anything we do that can save a baby's life is the right thing, whether it's at a handoff face-to-face or whether it's placed in a baby box. I think saving the baby's life is something we should all strive to do. With that, I renew my motion.
All right, thank you. Any further questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 1922 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. The bill goes on to calendar and rules. If you wish to be recorded as a no, please tell the clerk.
Thank you, committee.
Thank you. All right, that we've disposed of item number 3, so that brings us to item number 4, House Bill 1971. Chairman Hawk, you are recognized.
Thank you, Mr. Chairman and members.
You have a motion and a second. And I believe there's an amendment that rewrites the bill. Is that correct?
There is drafting code 014680.
Okay. You have a motion and a second on that. If there's no objection, let's go ahead and get the bill in proper form. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman, members, and I ask forgiveness for my voice. As I stated in committee earlier, the tulip poplars blooming outside have gotten to me, so I apologize. As many folks know, Chairman Terry and myself, we've been working on the TANF program, Temporary Assistance for Needy Families, and how we can better address some of the needs of Tennesseans. And a few years ago, we passed legislation that created the Tennessee Opportunity Act. And therein, there have been 7 pilot programs that have been created as well. They're up and running and doing some incredible work. We had a bit of delay. Department of Human Services had a bit of a delay in getting together with the research partner and being able to accept data in the format that we're going to be accepting data. And it's going to take us a year longer than we had first anticipated to get that data collection. This information is critically important to us as we make decisions on how best to utilize these dollars in the future. So essentially what the bill does as amended, it extends the pilot programs for a year to ensure we were receiving useful data to measure. Says that the contracts will go now until December 31 of the year 2026. That's what we do, Mr. Chairman and members.
Thank you. Do we have any questions for the sponsor of the bill? Representative Hakeem, you are recognized.
Thank you very much, Mr. Chairman. Chairman Hall, we're all conscious of, I guess, having families in need. While we're waiting on this process to be completed or developed, are we still assisting families who are in need?
You recognize?
Yes, and thank you for the question, Representative. The funding amount for these 7 pilot programs over 3-year timeframes is $175 million, $25 million per program. We have $191 million roughly coming in on a year's time, and those dollars are still going out the door to assist families. And many of the programs that we're looking at, just as an aside and an addition, are showing us ways that we can better utilize those additional $100+ million that we're seeing. So the long answer to say, yes, we are still utilizing all the other nonprofit programs that we have in place. Thank you.
Any further questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 1971 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 5, House Bill 1973. Chairman Hawk, you are recognized.
Thank you, Mr. Chairman.
You have a motion, a second, and is there an amendment that rewrites the bill?
We do have an amendment on this bill as well. I believe it's 014247.
Okay, that's what you have a motion and second on the amendment. If there's no objection, let's go ahead and get the amendment on the bill. All those in favor of amendment 014247 say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman and members. This bill is dealing with the recommended uniform screening panel that is administered to screen infants shortly after their birth. There's several conditions that this screening detects and looks for, and we can find early detection of these potential maladies long before they would ever present themselves as a sickness for the individual, and can help save the family's time and money and really heartache as they're trying to diagnose their child. Essentially what this bill does, it's a reporting bill. It doesn't change anything that's in the current structure, but it says that whenever a condition is added to the recommended uniform screening panel on a national level, that the state of Tennessee will attempt to add that as quickly as possible. If something is not added within 36 months, then the Department of Health must give us a report to our chairman of health departments and leadership and let us know what's going on. So it doesn't really change anything that's going on in current law, but gives us a report if a screening panel is not added to the data that we're collecting right now. Chairman and members.
Are there any questions for the sponsor bill? Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Chairman Hall, do we have any information as to whether insurance companies can utilize at this point? Do you have any idea if anything is being discussed about knowing where there are abnormalities and so forth and not insuring those or taking people off their insurance?
You recognize?
I have no data to back that up, and I know that pre-existing conditions, I understand what that could be deemed, but this individual would be born with that, and actually, I think it would be helpful for insurance companies to know and understand that. I think I understand what you're saying, and I do not see it to be an issue for insurance companies.
All right. Thank you, Mr. Chairman and Mr. Chairman.
Thank you.
Any further questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 1973 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and members.
All right, that brings us to item number 6, House Bill 2081. Representative Alexander, you are recognized. You have a motion and a second.
Thank you, Chairman, and thank you, committee.
Okay, you're recognized.
Okay, thank you. I do have an amendment.
Okay. Okay, amendment drafting code 014291, is that correct?
That is correct.
Okay, you have a motion, a second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are on the bill as amended. You are recognized.
Thank you. Committee, what this bill does is we have what is called PSSAs. Those are personal support service agencies. And inside those PSSAs, there are people who work those jobs that are called direct service providers. They go into the home, perhaps they bathe your mother, they get groceries, they help with some light household things, they take care of her needs, they read to her, whatever. And what this allows them to do is to be able to hand her her medicines that she's normally taking. And they do this after they have been certified by the same program that DID goes through, where they could administer meds, not intravenous medicines, but over-the-counter meds. And that's all this bill does. It gives them the ability to do it. It helps with our nursing shortage, and it helps people that need this.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2081 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you. Thank you, committee.
Item number 7 has been taken off notice, but I see the sponsor of that bill has item number 10 as well. So if there's no objection, I'm going to take Representative Freeman out of order for House Bill 2405. You have a motion second. You are recognized on the bill.
Thank you, Chairman and committee. I also have an amendment drafting code 014077.
Okay. Let me find it here. What's that number?
On the right. Yep. Yeah.
Okay. Oh, shoot. Sorry, I've got my notes here that are, it's long. Okay. 014077.
Yes, sir.
All right.
So-
You have motion second. So if there's no objection, all those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Yeah, so what this bill does is create the Social Work Licensure Compact, which is an interstate occupational licensure compact. We would allow for social workers to freely move across and practice across the other partner states. Having Fort Campbell here, we have a lot of new business and people moving. We've got spouses that may be social workers, and this will allow them to continue to practice. And with that, I renew my motion.
All right. Do we have any questions for the sponsor of the bill? Representative Bain, you're recognized.
Just want to say, as the only registered licensed social worker in the entire General Assembly, thank you for bringing this forward, and I'm happy to support it.
Thank you.
Thank you. Any further questions? All right. Seeing none, we're going to vote on House Bill 2405 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations. You're recognized.
Chairman, I know pigs get fat, hogs get slaughtered, but also have item 17 on the calendar.
Ooh, I've got to get through these first 12 bills first so that we can get
Fair
through.
enough. I'll just sit here and
Yeah.
listen.
All right, thank you. That brings us back to item number 8, House Bill 2289. Chairman Boyd, you are recognized. You have a motion, a second, and you
Thank-
have a amendment that rewrites the bill. Is that correct?
That's right, Mr. Chairman. I'm showing drafting code 15058.
That is correct. You have a motion and second. If there's no objection, let's get the bill in proper order on Amendment 015058. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman of the committee. Members, House Bill 2289 is a result of a 2022 study that studied the compensation and the workforce development of the healthcare professionals in Tennessee. It applies specifically to medication aides. Medication aides are essentially CNAs with an additional level of training. They traditionally work in nursing homes and assisted living facilities. This bill would simply allow them to do 3 additional things. That is to administer metered dose inhalers without a spacer, administer nebulizer treatments, and administer oral or topical drugs on an as-needed basis pursuant to the nursing delegation without a prior nursing assessment. And just to remind you, they do work under a nurse. Mr. Chairman, I'll take any questions.
All right. Any questions for the sponsor of the bill? All right. Questions have been called. We're voting on House Bill 2289 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. All
Thank you, Chairman of the committee.
right. I'm going to pass the gavel for the next 2 bills to Chairman Leatherwood.
Okay, this brings us to item 9 on the calendar, House Bill 2371. And Chairman Terry, you are recognized on the bill. I've got a motion and a second, and looks like there are no amendments to the bill.
Yeah, thank you. Yeah, the bill, it looks like a caption bill, but it does what it says it does. It increases from 48 hours to 2 business days, the time in which a physician in charge of a patient who dies or a medical examiner must determine the cause of death and complete and sign a medical certification of death.
Okay, the bill is properly before us. Any questions of the sponsor? We've got the question on the bill. Without objection, we'll go ahead and we will vote on House Bill 2371. All those in favor say aye.
Aye.
Any opposed? The ayes have it. And this bill moves on to calendar and rules.
Thank you, Chairman and committee.
Then takes us to item 11 on the calendar, House Bill 2522. Got a motion and a second. The bill is properly before us. Chairman Terry, you are recognized on House Bill 2522.
Thank you, Chairman Committee. And this bill authorizes the Board of Osteopathic Examination to issue advisory private letter rulings upon request to the affected licensees regarding matters within the board's primary jurisdiction. Provides that such rulings only affect the licensee making the inquiry and have no precedential value other than inquiry or future contested cases that might come before the board.
Okay, are there any questions of the sponsor on this bill? Seeing none, we will be voting on House Bill 2522. All those in favor say aye.
Aye.
Opposed? The ayes have it. House Bill 2522 will be going to calendar and rules. Thank you.
Thank you, Chairman and committee. That brings us to item number 12, House Bill 2907 by Chairman Kumar. You are recognized. You have a motion second.
Thank you, Mr. Chairman. House Bill 2907 is meant to clear out the confusion whether and when physicians can prescribe medications to themselves or to their families. Current impression is that they cannot, but there is no federal or state law that prohibits it. Generally, it's considered wise not to treat your family at a close level because it may interfere with your thinking, and sometimes if family gets dependent on that for a long period of time, they may not be thoroughly examined by another physician. To clarify the air, this bill has combined the policy guidelines of the Tennessee Medical Association and the Code of Ethics of the American Medical Association to reach the conclusion that a physician can treat themselves or their family in case of minor, short-term, self-limited illnesses or in urgent and emergency situations. they are also allowed to treat their family if they are the sole provider of healthcare in a 30-mile radius, in the sense the common situation being they're treating everybody else's blood pressure, but they cannot treat their mom's. So we've allowed for that. And in any case, opioid prescriptions to themselves or family under any circumstances are not allowed. With that explanation, Mr. Chairman, I look for positive recommendation.
Thank you. And I believe we have an amendment for your bill that
Oh,
you
I
just
forgot that.
described, amendment drafting code 014554. Is that correct?
Yes, sir, that is
Okay,
correct.
Motion is second. Okay, if there's no objection, let's get the amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. Are there any questions for the sponsor of the bill? Questions been called. Without objection, we're voting on House Bill 2907 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. All right, that concludes the bills that we had rolled from last week. And again, if you passed your bill and it was going to calendar and rules, get that information to Chairman Zachary so that he can create his addendum calendar. All right, that brings us to item number 13, House Bill 2773. Leader Cochran, you're recognized. You have a motion, a second.
Thank you, Mr. Chairman. And we do have an amendment if you want to.
Okay. We're going to go with amendment, but drafting code 015824. Is that correct?
That's correct, Mr. Chairman.
Okay. Okay, you got a motion, a second. If there's no objection, all those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bills amended. You are recognized.
Thank you, Chairman. House Bill 2773 clarifies in Tennessee law that a parent has the ability and the right to see their child's prescription records if they ask for those, as well as it adds a duty to warn for a medical provider if a minor is having suicidal ideations, that they must warn the parent. Those are the high points of the legislation, but I will yield to any questions.
Do we have any questions? Okay, Representative Bain, you're recognized.
Thank you, Chairman. Quick question. So what happens if the child comes from an abused family and the parent is the abuser?
You're recognized.
Thank you, Chairman. There is a provision in the legislation that if it's a situation where the physician has reported parents to DCS and then after that report, they feel that divulging any type of prescription information would result in some type of harm to the child, that they would be absolved from that responsibility. They would not have to report. They would not have to tell the parent at that point. But it would have to be a very specific situation where the physician has recognized abuse and they have reported that to DCS.
Okay.
You're recognized.
Thank you, Mr. Chairman. To clarify, so the physician who's seeing the child, so say the child is removed from the familial setting due to domestic abuse, the child would see the physician, and then the physician, based on that conversation, would make a report to DCS, and DCS would determine whether that the parents of that child should receive the records.
You're recognized.
Thank you, Chairman. Well, and I think maybe just to clarify further, this bill does not require an automatic report to the parents. This is just if the parent asks, if they say, my 16-year-old came in last week, I would like to see those prescription records. So in the situation you just described, if the child is already in DCS custody, I think the response would be that at that point, they are not the legal custodian of that child. So they don't have the ability to ask for those records.
You're recognized.
Okay, let me give you, if the child is not in DCS, so say a child comes from a domestic abusive home, a parent of a friend brings the child to the physician sees the child. If the parents request the medical records from that physician, then this law would grant them the ability to do so.
You're recognized.
Thank you, Chairman. Yes, unless the physician has, again, recognized the abuse of that child and reported it to DCS. At that point, they would not have to give the parent that record.
Okay, thank you.
Who else do I have? Chairman Boyd, you're recognized.
Question on the bill.
Oh, there we go. If there is the question's been called. All those in favor of House Bill 22773 as amended, say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and Committee.
All right, that brings us to item number 14. He is not here, so without objection, we're going to roll House Bill 2212, 3 spaces. And who's carrying? Davis. Okay, there's Davis. Okay. That brings to item number 15, Senate Joint Resolution 0160. Representative Davis, you are recognized. You have a motion second.
Thank you, Chairman, and thank you, Committee. And essentially, this is a resolution stating the intent that we would like to have folks who are visually impaired or blind to allow for a facility to be either leased or somehow operated close by, and we're supportive of that, and that our Department of Human Services is supportive and instrumental in helping those groups to kind of get that that building. There's 3 different organizations or 3 kind of main advocacy groups: the Tennessee Council of the Blind, the National Federation of the Blind, and the State Rehabilitation Council. And so the department, I've spoken to them, and they're supportive of this. This is passed in the Senate, and they're willing to help those groups to try to work with any sort of grants or try to make sure that those facilities come in line so that all of those services that they need, that they can try to have some place to work on those vocational skills.
All right. Any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on Senate Joint Resolution 160. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you. Thank you, Chair.
All right.
Thank you.
I see that Chairman Haston came in, and so if without objection, we're going to go back to item number 14, House Bill 2212. Chairman Haston, you are recognized. You have a motion and a second.
Thank you. Sorry for being late. Was in another committee presenting a bill.
That's that time of year.
Yeah.
We all know.
This bill's intent is to help improve reopening opportunities for failed or abandoned rural hospitals and hopefully prevent them from ever closing in the first place. It does this by authorizing the comptroller to put in some protective measures, along with the ability to transfer operations of ownership of a government-owned rural hospital to a healthcare operator, corporation, or organization if it is determined the hospital has failed or been abandoned. With that, I'll be glad to answer any questions.
All right. Okay, we've got Representative Capley. You are recognized.
Thank you, Mr. Chairman. Chairman, thank you for bringing this legislation. We've had several hospital closures in our area. We're fighting to keep one right now in Wayne County. So good bill. We appreciate you.
All right, thank you. Representative Bain, you're recognized.
Thank you, Mr. Chairman. I had the pleasure of visiting former Minority Leader Rep. Fitzhugh before I started my tenure here. And this community, as you all know, they lost their hospital. It took an act of the community coming together and raising hundreds of thousands of dollars to bring the rural hospital back, which now it's working and functional. And I visited it during my trip. My question for you is, what is the community involvement with these negotiations, and how much weight does the community have in terms of the negotiations with the comptroller should these discussions be initiated?
You're recognized.
I think a lot of that will come from how the comptroller ends up promulgating the rules of how that process. I would assume that they would be heavily involved in anything that goes on with their community, but that would be up to how the comptroller ended up probably putting those rules into place later on if this did become law. But to your point, you make a good point. One of the things about what we're seeing happen is we have a lot of bad actors that come in and just run the hospitals down to the point where they're failing or abandoned. And then the licensure is tied up with those bad actors. And we're trying to put some measures in place that prevents that from ever happening. But if it does, there's some methods for us to be able to get that licensure away from the bad actors in a much smoother fashion.
Any Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. The bill authorizes a fund to be established. Who would basically be funding that?
You recognize.
What kind of bank account do you have?
One they can buy a hospital.
That's the question for a lot of these bills that come through. Of course, we've got an uphill battle as we get towards the next step, if we do have a next step. But as far as the way that the funds would be utilized, if they are found, it would go towards 4 senior investigators, investigative counsel, and specialized medical personnel to be able to handle the load that the comptroller's office would have if this were to become law. But as with everything, it's a matter of finding the funds. Yeah.
You recognize.
Yeah, I think the way it's worded is just, it says the bill authorizes the fund to be established to support government-owned rural hospital transfers under this bill. So into the example my colleague from Davidson County mentioned, so that's why I was assuming they would establish a fund that would allow these transfers, if the community, local government entities, et cetera. So thank you for that. And then my second question is around, just to clarify, this would only be investigative powers for government-owned hospitals, correct?
You recognize.
I believe that is correct the way it's worded currently. Yes.
Okay, thank you.
Okay. Any further questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2212. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman, Committee.
All right, that brings us to item number 16, House Bill 2254. Representative Love, you have a motion, a second. You are recognized.
Thank you, Mr. Chairman. House Bill 2254 adds 3 persons to the Child Fatality Review Team. This team was established in 1995, and it is a published report on the Health Department's website. It also will send a copy of the report to each LEA and to the board of the Tennessee chapter of the American Academy of Pediatrics to make sure that everybody gets information about how we can reduce child fatalities in Tennessee.
All right.
Thank you, Mr. Chairman. I stand for questions.
All right, thank you for that explanation. Any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2254. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Counter and Rules.
Thank you, Mr. Chairman and committee members. I really appreciate you all taking the time out to let me run this bill. I'm trying to stall for Bob Freeman for a minute.
All right, that brings us to item number 17. House Bill 2327. Representative Freeman, you are recognized, and I believe you have an amendment that rewrites the bill. Is that correct?
Yes, 013982.
Okay, you have a motion, a second on the amendment. If there's no objection, let's go ahead and get the amendment on the bill. All those in favor of amendment 013982, say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Chairman and Committee. So a few weeks ago, we all had the benefit of having the Foundation for Suicide Prevention come talk to us about suicide in our state. And we lose about 3.3 people a day in Tennessee. As of today, about almost 200 people have lost their lives to suicide. We are 25% higher than the national average. The Department of Health currently produces a report. They're doing it annually now, but by statute, it's every 2 years. And it calls out how many suicide attempts there are in our state, who are the groups that are attempting suicide. And in their report, there's a quote. It says, "To fully understand the impact of suicide in Tennessee and improve prevention efforts, we must continually review suicide-related data to identify the groups of people most at risk for suicide." And so what this bill would do is codify, one, that they do this report annually, and number two, that by May 31st each year, the Department of Health shall publish this report and distribute it within 7 days to the General Assembly so that we can have the data to fully understand what suicide and the effects it's having across our state. And with that, I stand ready to answer any questions.
Any questions? Representative Payne.
I'm very talkative today, so thank you for humoring me. I've been, for the past few years, Tennessee has been ranked in national studies as the most depressed state, the most stressed state. Do you have any ideas as to why that might be?
You recognize?
No, but I hope this report will help us dig into that and trying to prevent suicides.
You recognize?
Thank you so much. It could be due to our policies, perhaps, that we're enacting in the state, perhaps.
You're recognized.
I'll renew my motion.
Okay. Representative Capley, you're recognized.
Thank you, Mr. Chairman. And to the sponsor, I just had a real quick question. Under the demographic information, it doesn't include gender. It says individual who attempted or completed suicide, including age, race, ethnicity, and income. Why is gender not included?
Gender is included. I'm not
Did I just
sure.
not see it?
Yeah, it's included in the report currently.
Okay. All right. Thanks.
Any further questions?
And I can share the
Oh, you're-
report with the, I'm sorry. I can share the report with the chairman, and he can share it with the rest of the committee if anybody'd like to see it.
All right. Any further questions for the sponsor of the bill? Questions been called. Seeing none, we're voting on House Bill 2327 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to counter and rules.
Thank you, Chairman and committee.
All right. That brings us to, let's see, 18 has been, okay, we've disposed of that one. That brings us to item number 19, House Bill 1853. Chairman Williams, you are recognized. You have a motion and a second. And is there an amendment?
I do have an amendment.
Rewrites the
Chairman.
bill, drafting
is.
code 014724.
Yes, sir.
Okay. You have a motion, a second on the amendment. If there's no objections, let's get the bill in proper form. All those in favor of amendment 014724, say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Chairman and members. This bill, as amended, would allow for the provision of physical therapy services in assisted living facilities. There was a practitioner called Fox Rehab who has 29 facilities across the state. And what they found out is that because they didn't carry a home health license for treatment, that someone who was receiving physical therapy, occupational therapy of that nature would have to would have to travel from their room in an assisted living facility to a therapy location. Many of you may not know this, but in the 19th century, physical therapy started from massage therapy in Europe. This bill would allow for those practitioners of occupational and physical therapy to be able to go to the rooms of those patients that they're already treating there, so that they can get the treatment that they need. With that, Chairman and members, I'm happy to answer any questions you might have.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 1853 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to counter rules. Brings us to item number 20, House Bill 2296. Chairman Whitson, you are recognized.
Thank you, Mr. Chairman. A request to present from my desk.
Okay, and you have an amendment?
Yes, sir. I have an amendment with drafting code 014962.
Okay, and that rewrites the bill, drafting code 014962. You have a motion and a second. If there's no objections, go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
I missed it.
You're recognized.
Okay, good.
Yeah.
I need his help on this bill, okay? So, thank you, Mr. Chairman and committee. This bill was brought to me by the Tennessee Marriage and Family Therapist to clean up the code dealing with licensure portability. Both licensure by endorsement and reciprocity for marriage and family therapy is currently in statute. With the endorsement process, marriage and family therapists licensed in another state can become licensed in Tennessee as long as they meet Tennessee's qualifications. The demand for mental health services in the state is extremely high. Marriage and family therapists can assist the families in the state deal with a multitude of crises. Tennessee currently ranks 46 in the nation for mental health providers per capita. We already have processes for counselors, and we have shown we are, as a General Assembly, are committed to increasing access to mental health care. The marriage and family therapists will still pay full licensure fees to the state And our state board will have oversight of their license, including any disciplinary actions. And with that, Mr. Chairman, I renew my motion.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2296 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
Thank you. All right, 21 was rolled 1 week. It was rolled a week, so that brings us to item number 22, House Bill 2004. Chairman Leatherwood, you are recognized.
Thank you, Mr. Chairman and committee, and there is an
You have a
amendment.
motion, a second? Okay.
Okay.
So you have an amendment. Drafting code, is it 013893?
Yes, sir.
Okay. You have a motion, a second, and that rewrites the bill. If there's no objection, let's get the amendment on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. This bill simply directs the Department of Health to investigate the frequency of cases of cancer and Parkinson's disease in Murray and Lawrence counties. The information reported will be produced in accordance with state and federal law to maintain the confidentiality of individuals. Appreciate your support.
Any questions for the sponsor of the bill? Representative Capley, you're recognized.
Thank you, Mr. Chairman. And Mr. Chairman, we appreciate you doing the great work for Murray and Lawrence County.
You are welcome. I renew my motion.
Thank you. Any further questions for the sponsor of the bill? Chairman Kumar, you're recognized.
Thank you. I'm sure there was a triggering event. Is there a particular cause for these that is suspected?
Well, there is concern with some of the residents of Murray and Lawrence County that there is an inordinate number of cases of cancer and Parkinson's disease. So because of the issue being raised locally, wanting to get hard information from the Department of Health as opposed to just anecdotal information between individuals within this area.
Well, thank you. I was just wondering if there is a particular plant in the area or a source is suspected.
Well, this would be step one to determine if there is an anomaly here, and then if that is determined, then would look at step two, what might be the causes.
Thank you. Thank you. That's very systematic.
Representative Hemmer, you're recognized. You're recognized.
Thank you, Mr. Chairman. Just curious why Department of Health isn't involved in this. Only TDEC's mentioned.
You're recognized.
Did I hear you were wondering why the Department of Health is involved? Just making sure I heard you right.
Yeah, I mean, just sorry, I might have gotten that wrong. The caption says Department of Health, but then the amendment says Department of Environment, Community and Conservation. So I just didn't know if they were being added in addition to Department of Health, or the Department of Health being taken out.
The Department of Health is staying in. The Department of Environment and Conservation is being taken out because, again, going back to what Chairman Kumar said, that would be getting more into step two, determining what might be causing it if there is an anomaly. So Department of Environment Conservation is coming out. Department of Health is staying in.
Yep. All right. Any further questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 2004. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right, that brings us to item number 23, House Bill 1682. I think Representative Martin, you are recognized. You have a motion, a second, and we have an amendment that rewrites the bill. Amendment drafting code 014768. Is that correct?
That is correct, sir.
Okay, need a motion? You have a motion, a second. Since it rewrites the bill, let's get the bill in the proper form. If there's no objection, we're voting on the amendment. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, committee and chair. This is administration bill from the Department of Mental Health and Substance Abuse. If you guys recall, last year, Public Chapter 199, we passed that better defined a qualified advanced practice provider. Effectively, what that was able to do was to provide eligible providers to execute the certificate of needs for involuntary admission in state-owned and operated inpatient hospitals. This bill will allow qualified advanced practice providers to complete one of the certificate of needs along with a certificate of need completed by a physician for probable cause hearing. This legislation would still require at least one of the CONs to be completed by a licensed physician. However, the advanced practitioner could be the second signature. This bill is also allowing certificate of need as long as the qualified advanced practitioner provider is not under the collaborative practice agreement with the licensed physician to sign that. So with that, I stand ready for questions.
Questions for the sponsor of the bill? All right, seeing none, we are going to vote on House Bill 1682 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. And that brings us to- All right. That finishes our calendar for the day. If there's no further business before us, we are adjourned.